Let's go ahead and get started. Good morning, good afternoon, good evening. You should be seeing me on video now. I'm Jessica Farringer. I'm the Director of the Data for Impact Project. Welcome, everyone. So this is our fourth webinar in our series focused on health equity and global health monitoring, evaluation, and learning, or MEL. This webinar features knowledge successes, equitable approaches, and tools in knowledge management, or KM. The webinar will be presented in English with simultaneous interpretation to French. Next slide. Here we have just an overview of what Data for Impact does. Data for Impact strengthens capacity to generate and use new high-quality health and related development sector data, use routine and other existing data, investigate program effectiveness, support adaptive management, and learn from evidence. You can see here the 6 different areas that Data for Impact works in. So as I noted, generate evidence, strengthen capacity through fostering collaboration, experimental learning, mentoring peer networks tailored to partners' needs. Ensure data quality. We also work on integrating gender throughout the project, promoting data usage, and learning. We try to encourage collaboration, improve results, and timely progress updates through idea exchange and shared learning. Next slide. So this is, as I noted, D4I's fourth webinar in our health equity in global health monitoring, evaluation, and learning series. Health equity is achieved when everyone has a fair opportunity to live the healthiest life possible. MEL plays a critical role in fostering equitable global health programs and policies. High quality data can help stakeholders better understand current health inequities, promote equity sensitive program approaches, measure progress towards equity, support accountability for equity, and raise awareness about actions that affect health equity. Our webinar today is focused on equity in knowledge management, or KM. KM and monitoring and evaluation are distinct yet very related disciplines that often work together in complementary ways to support learning, decision-making, and adaptation. Equity in KM for health programs is achieved when the health workforce has the information, opportunities, skills, and resources to define and participate in knowledge access, creation, sharing, and use to improve health programs. Today, our webinar includes speakers and a panel from Knowledge Success at the Johns Hopkins Center for Communication Programs. They will discuss what equity in KM means, why it matters, and how to integrate equity into KM. Our 3 panelists include KM Champion Innovators from Season 2 of the Pitch competition, which provides funding to start or scale KM initiatives. The KM Champion Innovators will explore challenges to equitable KM in their countries of India, Madagascar, and Nigeria, and share how they address those challenges. I will now hand over to Rowena Salem, Knowledge Solutions Team Lead at Johns Hopkins University Center for Communication Programs, to start the presentation and introduce the panelists. Thank you. Over to you, Rowena.
Thanks so much, Jessica. Very much appreciate that introduction, and thank you all for joining us today. Next slide. As Jessica mentioned, we are providing French interpretation. So if you would like to click on the interpretation icon at the bottom of your Zoom screen and select the language of your choice, and then you'll have the option to mute the original audio so you don't hear that in the background. I think one of my colleagues will also be dropping a link to view the French version of these slides for those of you who'd like to follow along in French as we display the English version. Next slide. You may also select to turn captions on to read the spoken audio during the session. Just go ahead and click on the icon with the 2 C's at the bottom of the Zoom screen. If you wish to hide the captions later, then just click on the same icon again and select Hide Subtitle from the menu that appears. Note that these captions are generated using an automatic feature in Zoom, and so they might not be 100% accurate, especially if you choose to see the captions in a language other than English. And finally, we are recording this webinar and we'll be emailing the recording out. So my name is Ruwaida Salem. I'm the Knowledge Solutions Team Lead at the Knowledge Success Project based at Johns Hopkins Center for Communication Programs. And I'm joined today by my colleague, Natalie Apkar, the Program Officer, also at the project. As Jessica mentioned, we also have 3 panelists joining us today. KM Champion Innovators from Knowledge Success's pitch competition. So we have Onyinye, Sramana, and Laura. Next slide. Here's our agenda for today. I'll kick us off by defining what equity in knowledge management is and providing an overview of the tools that we've developed for equitable knowledge management. Then my colleague Natalie will provide an overview of how Knowledge Success has used these equity tools in the hopes of inspiring others to also use them in their work. Next, our 3 panelists from the pitch competition will share information about their KM innovations that were funded by the pitch. And I'll also moderate an informal Q&A with each panelist to dig into the equity challenges that they addressed through their KM innovations. And then we'll turn it to questions from the audience, which Natalie will moderate. So if you have any questions, please use the Q&A portion in Zoom, not the chat. And you can type your questions in English or French. We'll either respond to your question in writing or answer it during the live Q&A portion toward the end of our session. All right, so now I'll provide an overview of the tools that we've developed. On the next slide, I wanted to just say a few words about Knowledge Success for those who may not be familiar with our project. The project is funded by USAID and it focuses on knowledge management for family planning and reproductive health programs, or FPRH programs. So in FPRH and global health programs, we typically think of our audience as women, men, children, adolescents, people in the community from the general population. But for our project and for knowledge management in general, our audience is the program managers, the technical advisors, and other decision makers who design, manage, lead programs, and evaluate programs to improve the health of people. So in other words, you all, as part of the health workforce, are probably people who make up the audience of Knowledge Success. And our goal is to make it easy for you to find, share, and use the information you need to inform and improve your programs. Next slide. So before we dig any further, I'd like to just make sure we're all on the same page in terms of what knowledge management is. So at Knowledge Success, we define knowledge management as a systematic process of both collecting knowledge and connecting people to that knowledge and to each other so that people can act efficiently and effectively in their work. We believe that knowledge is one of our most valuable assets to address global health challenges. What we know impacts how we take action, and how we manage knowledge can affect individuals and programs and ultimately health systems. Knowledge management can also improve coordination and enhance meaningful learning among health professionals, ultimately leading to improved health outcomes. Many of us practice knowledge management every day without realizing it. For example, when a healthcare provider refers to the latest guidelines on how to treat a disease, or a program manager reviews health systems data in order to inform their programs, or when a technical advisor joins a working group meeting to share implementation details with external colleagues. They are all using knowledge management. And in each of these examples, health professionals are collecting knowledge and connecting people to it. Next slide, please. So Jessica talked a little bit about, the relationship between knowledge management and M&E. D4I is an M&E focused project, and many of you all may be M&E practitioners yourselves. So you may be wondering why we're focused on KM in this webinar. We see KM as a strategy or approach to help organize the body of information and evidence coming from M&E studies. KM can also help to support effective use of the M&E results by sharing the results in easy to digest formats that are tailored to the specific audience needs, and also through peer-to-peer learning and knowledge sharing around the M&E results. We see that there are many synergies between KM and M&E as they both focus on collaborative learning and improvement of programs and policy. Okay, so without further ado, let's get into the topic of equity. Many of you may already be familiar with what equity in health means. According to the WHO, health equity is the absence of unfair, avoidable, and remediable differences in health status among groups of people, whether those groups are defined socially, economically, or geographically. And health equity is achieved when everyone can attain their full potential for health and well-being. The image on this slide is a reminder of the difference between equality and equity. With equality, everyone is given equal treatment, but with equity, the focus is on equal outcomes. And it recognizes that some groups may need more support or resources to achieve the same outcomes due to social injustices that they may experience, such as discrimination or poverty. Next slide. So let's move into equity and knowledge management. So we define equity and knowledge management as the absence of unfair, avoidable, and remediable differences in knowledge creation, access, sharing, and use among groups of health workforce members. And similar to WHO definition, we can define those health workforce members socially, economically, or environmentally. So we drew very heavily on the WHO definition of equity in health. And the key point here is that programs need to address the unfair and avoidable differences among groups of health workforce members in terms of their access and use of knowledge. And we believe that equity is achieved when all people in the health workforce have the information, the opportunities, the skills, and resources they need, not only to participate in that knowledge cycle, but also to help define what that knowledge cycle looks like. Next slide. So we view diversity and inclusion as tools to help us achieve equitable knowledge management systems, processes, and outcomes. This means intentionally including all members of the health workforce in knowledge management and valuing their ideas, their skills, their experiences. And it also means including diverse people in leadership and decision-making roles. With this intentional focus on diversity and inclusion, we can help shift negative and detrimental forms and effects of power over individuals and groups toward positive expressions of power and agency, including the power to take action and the power with others to take collective action. These shared power structures and inclusive approaches will in turn create more equal KM outcomes across the health workforce, and ultimately lead to improved health programs. On the next slide, I wanted to show, from our experience, two organizing frameworks that can help us to integrate equity in knowledge management. The first is the Knowledge Management for Global Health Logic model, which outlines the inputs, the processes, outputs, and outcomes you expect to achieve with KM initiatives. And the second is the Knowledge Management Roadmap, which outlines a systematic process to use when developing KM initiatives. Both the logic model and the roadmap can be found on the KM training package website. They're published in the Building Better Programs Guide and a shorter pocket guide version. And the links are on this slide, but we'll be dropping them in the chat as well. And I'll be going into just a little bit more detail about these two organizing frameworks, starting on the next slide. The first tool is the KM for Global Health Logic model, which was developed by the Global Health Knowledge Collaborative to assist with planning and evaluating KM interventions in global health programs. As with other logic models, it provides a visual depiction of the inputs or investments that you put into KM initiatives, the processes you follow, and the outputs you create, and finally, the outcomes you expect to achieve as a result of that work. The latest edition of the Building Better Programs Guide includes an updated version of this logic model with equity considerations integrated into it. And these equity considerations flow through each stage of the logic model. And we can see a little bit of that flow with the equity prompts on the next slide. So with each stage of the logic model, starting with inputs, we noted how equity plays a role and what a health workforce member might ask when in that stage of KM to assess and to decide if KM, if equity is integrated into that stage. So these are not an exhaustive list of questions, rather it's something to get you started thinking about equity in each of these stages. These questions bring out questions of power, decision-making, and value. For example, in the input stage, some of the equity considerations you'd want to take into account are whose voices are included or excluded in knowledge management systems, and who makes the decisions on what kinds of data and information are being captured. Similarly, when you look at processes, you can consider who's involved in generating new knowledge, in synthesizing it and sharing it. Are power and privilege influencing those decisions? And when considering your KM outputs, these are like the KM events that you convene, the KM products you developed, and the publications and resources you publish. You'll want to consider 4 essential elements to ensure that they are effective and equitable. Those essential elements are availability, accessibility, acceptability, and quality. I won't go into a lot of detail about these, but basically, KM tools and techniques should be available to all members of your intended audience. They should be accessible to everyone at no or reasonable cost and consistent with their needs, considering things like technology, formats. They should also be acceptable in that they are respectful of culture and sensitive or responsive to people's identities. And finally, they should be of high quality. That is, that they should be accurate, up to date, unbiased, and relevant. In all, the updated logic model with the equity prompts can be used as an organizing framework when planning or monitoring your KM initiative. The next slide here shows the other main tool that we've created around equitable KM. So this is a practical checklist to assess equity in KM initiatives as you are designing those KM initiatives and implementing them. This is something that our own project staff members were asking for, and we also heard from other colleagues and other projects that a practical tool like this would be helpful to their staff as well. The checklist is organized around the KM roadmap shown on this slide. So we want to thank the many people who have reviewed this checklist and shaped it into the version it is today. And we see this as absolutely a living document because we are still learning about equity in KM as well. So this is meant to be a reflective tool with the goal of raising awareness about potential inequities in KM and suggesting how the inequities can be addressed. The checklist has an accompanying how-to guide, which gives more context to the checklist questions. So it could help teams to be able to answer those questions. You can also find the checklist on the KM training package website, and we'll drop a link for that in the chat as well. So on this next slide, this gives just a glimmer of what you could find in the checklist. There's several checklist questions for each step in the roadmap. This is just an example of step 3 of the roadmap. Step 3 is where you create all the KM tools and techniques for your KM initiative. And so this checklist items are organized around 2 categories. KM tools and techniques that focus on asking and telling. So these are like your interactive KM events and activities. This webinar could be an example of a KM event. The other category is publishing and searching KM approaches. So these are more of your publications, websites, and databases. So a couple of illustrative checklist questions: do KM event facilitators, moderators, speakers, etc., reflect the diverse backgrounds or experiences? And are you creating content in a range of formats to meet people's different learning preferences? Some of these may seem very obvious to people, but we find that it's helpful as a prompt and a reminder as you're designing and implementing your KM activities, because sometimes it's very easy to lose sight of these elements as well. With that, I'll turn it over to Natalie.
Thank you, Rueda. And hello, everyone. Good afternoon or good morning. I'm Natalie Apkar, and I'm going to share with you all how we at Knowledge Success have begun looking critically at equity among our activities and teams and how we've been responding to our findings. Next slide. So as Rueda shared with us, we use the logic model and the KM roadmap as frameworks for evaluating equity and integrating it into KM programs. The logic model was helpful in developing survey questions for an equity-centered assessment of one of our 3 KM solutions called learning circles. And the model and its accompanying prompts that Rueda just shared can be used for similar evaluations of equity by other projects. So from the equity prompts, we developed survey questions like Rueda shared that we use specifically for the learning circles evaluation. And we looked at the availability, accessibility, acceptability, and quality of learning circles, which we can just say in shorthand, AAAQ. So measurements of AAAQ include questions such as, is knowledge available in a wide range of formats and a wide range of tools and techniques are available to everyone in the health system, which would measure availability? And are the knowledge and KM tools and techniques accurate, up to date, non-biased, and relevant for the intended audience? That would measure the quality. And we found the equity checklist as a complementary tool to the logic model, providing more in-depth and nuanced considerations related to the design and implementation of KM programs and activities, as well as to our own internal team structures and dynamics. Next slide. So here are just some sample equity-centered survey questions that we used in the assessment. So participants rated the following on a scale of 1 to 5. Some of the questions were related to, was learning circles respectful of their culture? Did they find that? Did they have any language barriers or other barriers to actively participating? And were the experiences and insights shared relevant to their own context? Next. So here is just a snapshot of the key learning circles assessment results. And you can go to the next slide, please. So if you see on the left-hand column, we refer to the AAAQ measurements, and in the middle column, the pertaining results. So one example, the number of participants in learning circles is usually around 30 to 40 per cohort, and it's capped at that, and that's for reasons of making sure that there's equal participation. This can mean that it's challenging to meet the significant demand, which is something that came up. To respond to that, we're in the process of developing guidance and tools for implementing learning circles without knowledge success support, which we'll make available as a training module on our website, kmtraining.org. Large majority of survey respondents said that learning circles was respectful of the participants' culture. In terms of accessibility, respondents noted that internet connection is of course required since it is a virtual workshop, which can potentially exclude people with poor access to the internet. We've recently adapted the program for face-to-face implementation that addresses this. Of course, that has budget implications. So the mode of delivery will depend on the specific context and needs. Also noted that for Francophone participants, there was often not enough time in the sessions for equal participation. So we responded to that by extending the sessions by a half hour. So these are just some of the results that we're sharing right now. And if you wanted to read in more detail about this assessment, there's a journal article published, which Rueda is going to send in the chat. Next slide, please. So let's turn now to the equity checklist. When we launched this, along with the updated Building Better Programs guide about a year ago, we knew that we were going to need to think critically about how we, as a team, were going to implement the checklist within our activities, within our work plan. We couldn't just talk the talk, but we needed to walk the walk as well. So the checklist takes you through the systematic KM roadmap process, like Rueda shared. And you can do this at the beginning stages of implementing a KM activity, in the middle as you're assessing how milestones are changing, and at the end to take stock. Different activity teams at Knowledge Success are implementing the checklist in varying ways that are agreed upon by team members. So some are individually, in an individual reflection exercise, completing the checklist using a tracking form that's then monitored by the team's checklist lead, and then they're meeting as a group, or some are completing it all together and discussing as they go. So in general, teams complete the checklist from start to finish to provide a baseline of equity integration into their KM. From that baseline, they identify priority actions that they need to take to improve equity integration. And we advise them to then meet periodically to assess progress, ideally quarterly. And as we're noting for our teams, I really want to highlight for you all that step 3 is especially important for the checklist, because this has more nuanced program implementation items. So it may be that your team only completes the other sections once or less often, but then comes back to this step 3 items. And the how-to guide can be very helpful for figuring out how to apply a specific item to your own context. The checklist was really written to be broad so that it could be applied to a lot of different scenarios. So the how-to guide can help you understand how to make it more specific to you. Next slide. So what did this exercise reveal? I want to share some of the strengths that we found, and then I'll discuss the gaps and the needs for improvement. I won't go into all of the details listed in this slide, but I want to touch on a couple key points. Web accessibility and language inclusivity. At Knowledge Success, we know that the web is fundamentally designed to work for all people. So the impact of disability is radically changed on the web, because it should remove barriers to communication that many people face in the physical world. However, when websites, applications, technologies, and tools are badly designed, it can create barriers or further reinforce barriers that exclude people from using the web. So Knowledge Success, therefore, works hard to ensure that our tools and platforms are designed with this in mind. We always try to include alt text in web images, which makes it easier for people with screen readers to read our content. And we recently just published the first audio version of a blog post so that people can listen instead of read. And I want to acknowledge that we certainly have much to learn in this area. I'm not acting like we've resolved all web accessibility issues on our site. But this is something that we're continuously trying to learn and improve. And then language inclusivity, if you've ever been to the knowledgesuccess.org site, you may have noticed that there's an auto translate plugin available for 11 languages. Our content is often translated by a human translator into French. That is often myself or other colleagues. Our West Africa hub page details more about our French language content, and we try and make all of our webinars available in French. And the reason for French is because that's the most common spoken language other than English among our majority audience, but we are aware of the need to include more diverse and non-colonial languages. So we are definitely part of that conversation. And then authorship and content pieces. We always try to remain completely transparent and give credit to everyone who was involved in developing it. That's why a lot of our blog posts often have 4 or more authors. And we always ask for consent when using photos. Next. So overall, we want to note the need to create time and space for these types of discussions within teams for each activity. When starting to plan an activity and set it all up, it can be very easy. There's lots of to-do items. It can be very easy to overlook some key equity-related questions, such as, are we ensuring an equitable gender balance of participants in our events? Or who are we not reaching with the chosen approach or format that we're using? So it's very important to set up, working sessions and really make time and space for this type of reflection. We're happy to report on the equity strengths that were revealed for us, but we can't talk about the strengths without talking about the needs for improvement. So, for example, in terms of disabilities, we realize that we're not always acknowledging disabilities that can affect participation in online events. And many of our knowledge sharing opportunities, especially since COVID, are online. So we want to get more inclusive in this area by asking participants when they sign up for an online training, and then working to accommodate that during the event. We also want to reflect on the stakeholders we engage with or partner with for our activities. This can include working groups, communities of practice, organizations, regional coordinating bodies. And we want to continue nurturing these relationships, but also look to strengthen relationships with other stakeholders outside of that. So we want to ensure equitable partnership in the regions where we work. And again, we're asking ourselves, who are we missing? Finally, we want to continue supporting and strengthening opportunities for co-creation of activities among the FPRH community that is inclusive. So one example of how we're responding to this, we recently sent out a call for youth content writers in Africa and Asia who will be compensated for their work writing content for knowledgesuccess.org. And we know that youth representation is critical, and we, as the flagship USAID KM project, we play a key role in supporting youth participation. Next slide. Great. So I'm just going to close here with these last points of guidance for other teams as they start to think about implementing the checklist. So there's just some points here which I won't go into in the interest of time. I did want to make sure and just highlight again about the how-to guide, which, it was very important. I think we recommend reviewing the checklist broadly, determining if any sections are not relevant for you and what really are and you want to come back to, and then use the how-to guide to help you learn how to shape a certain question for your context. And then, as Rueda mentioned, we are, this is something that we're very open to receiving feedback on. We're very interested in hearing how implementing the checklist in other teams goes. So if you have anything to share with us at all, please get in touch. We'll share our contact info at the end of this presentation. Thank you. And now I'll pass it back to Rueda in the next slide.
Thank you so much, Natalie. I'm really excited now for the next segment in our agenda, when we'll hear from the KM Champion Innovators from our pitch competition. And just to note that these innovators didn't necessarily use our equity tools that we've just been talking about, because the tools hadn't actually been published by the time of the season 2 pitch competition. But equity was one of the selection criteria that judges considered when awarding the winners of the competition. So you'll hear soon that some of the issues raised in Knowledge Success's equity tools, like considering your audience's language preferences and their needs for different formats, are indeed aspects that the pitch panelists addressed in their KM innovations. Next slide. And before I turn it over to our panelists, I just wanted to say a few words about the pitch for those of you who are wondering what in the world we're talking about. So the pitch is a regional competition for organizations based in sub-Saharan Africa or Asia to be awarded up to $50,000 each to implement innovative knowledge management approaches that are specifically for family planning and reproductive health programs. In season 2 of the pitch, we received over 80 applications. 10 semifinalists were chosen to pitch their innovation to a panel of global judges, and we ultimately selected 5 KM champion innovators to implement their KM innovations, and you'll be hearing from 3 of them today. So without further ado, let me turn it over to Onyinye Eda from Strong Enough Girls Empowerment Initiative, or SEGI, based out of Nigeria.
Awesome. Thanks so much, Rueda. I trust everybody can hear me okay, so you can give me a thumbs up, but I will continue. So thank you all for this opportunity to share about Strong Enough Girls Knowledge Management Innovation, which was funded by the pitch competition. So really, our innovation began with 2 questions. The first question was, who is an expert? And the second question was, in a post-family planning 2020 world, what more can we do to accelerate country and global family planning progress? I think you can go to the slide. Yes. So for us, the answer to that question lies in harnessing indigenous knowledge and youth expertise. We believe that young reproductive health leaders in countries like Nigeria, with a spiraling population of over 200 million people, young leaders must be provided with opportunities to share their knowledge, as well as discuss best practices with globally recognized experts. We also wanted to bridge the gap in information sharing and access, particularly between Anglophone and Francophone Africa, because we've seen that our problems are similar and there is much to learn from our context-based solutions. Therefore, we conceptualized the Indigenous podcast, which began as a bilingual English and French podcast idea, but it evolved into a multilingual project because we know that equity extends beyond 2 languages. And the goal of the Indigenous podcast was really to advance youth-led, intergenerational, cross-cultural, and cross-regional learning that will promote equity in family planning and reproductive health in terms of information access and use, and ultimately bring about transformational reproductive health outcomes that we want to see in our countries. Next slide, please. So how did we go about implementing this project? We can just go through all of the activities. There are 6, I'll call them phases that we went through. This was a 5-month project, but we started with a co-creation workshop, which was held in May last year. Please feel free to go to the next. I know, sorry about the animation, but once we get to the 6th bullet, you can stop. So yes, we started with the co-creation workshop, and then we had a launch event where we introduced this project in Nigeria to our stakeholders. And then we also asked our stakeholders to help us in recruiting the family planning and reproductive health champions that would be highlighted in our podcast. So we went through a national recruitment in Nigeria and the Republic of Niger. And after we identified 20 young people, we took them through a 4-day workshop that focused on storytelling and social media. How do you use social media to advance family planning and reproductive health? So these workshops were held in Abuja, Nigeria, as well as in Niamey, in Niger. And then following the workshop, we then began advocacy visits. We also released the episodes. We were able to have 20 episodes in different languages. And we also gave our champions an opportunity to visit the radio stations and have their voices heard on radio, because talking about equity, we can't just focus on social media. We need to also harness traditional media platforms. So our champions were able to go on radio stations and talk about their family planning experiences. And then we closed the project out in September last year. All right, next slide. So because of time, I'll just go quickly over our highlights. What were we able to achieve in this project? So as I mentioned, we identified 20 young champions from Nigeria and Niger. And this was the first of its kind indigenous language storytelling podcast, which was really exciting for us because our audiences got to hear a language that you're familiar with when we're talking about issues like family planning and reproductive health. Particularly exciting was for us to position indigenous youths as experts. As I said, one of the questions for us was, who is an expert? So we wanted to promotes and showcase young people as the problem solvers and the family planning experts. And we were able to transcribe the podcast. As I said, they were recorded in local languages, but for audiences that don't understand the local language, we were able to create transcripts in English and French. And through this activity, we were able to strengthen the knowledge exchange between Anglophone Africa and Francophone Africa using Nigeria and Niger as our case study. And our youth champions were really excited to learn from each other. And then lastly, we were able to take 3 of our champions to Thailand in November last year for them to talk about their family planning stories and showcase the podcast during the International Conference on Family Planning. Next slide, please. So this next slide will just show some of the statistics based on our 5 months, but these numbers have increased ever since we got these numbers up on the screen. But just to let you know that we had a website, and we will share the link to the website so that you can listen to the podcast yourself. And thus far, we have over 379 visits to the website. And based on our last check, the most played episode is the episode that was shared by the former youth focal points, the former youth family planning 2030 focal points, Bless Me Ajani, and she talked about how well Nigeria did in incorporating young people into its family planning commitment process and implementation of their commitments. We also have an Instagram page, which to date has over 2,295 views. We have over 198 followers. And the most viewed episode on Instagram is an episode by one of our champions where she talks about how well people with disabilities are being carried along when it comes to sexual education. So that podcast was titled, Do Persons with Disabilities Really Need Sex Education Too? All right, as I said, the numbers continue to increase as we continue to promote this podcast series. All right, the next slide, I am almost done. The next slide is just going to show you 2 infographics because we wanted to ensure that there was something tangible that we could share at the International Conference on Family Planning and also to other stakeholders that just show a glimpse of some of the stories that we're able to collect. And so we have 2 infographics. One is in English, the other one is in French. And we hope that for future iterations, we can get them in the local languages as well. And then finally, one of the other activities we did was that we hosted Instagram live conversations because we wanted young people to be able to speak with global experts. You can move on to the next slide. So we hosted 2 Instagram live conversations. One was with a colleague from the Ouagadougou Partnership, and that was in French and English. So that was a very exciting conversation where we just talked about what are some of the cross-regional things we can learn about advancing family planning knowledge sharing. And then the second conversation was with colleagues from the PACTS, it's a youth collective, as well as AIDS Healthcare Foundation. We spoke with the advocacy director there about how we can continue to ensure that young people's voices are carried along when it comes to harnessing the expertise they have in family planning and reproductive health. So that's just an overview of what we did. Thank you so much. I look forward to any questions that might come up.
Great. Thank you so much, Onyinye. I know you were trying to cover a lot in a short amount of time. Before we move on to Population Foundation of India, I just wanted to ask, in your initial design of the podcast series, you envisioned it would be a bilingual podcast in English and French. I just wanted to understand what prompted you to go beyond what we consider these as traditional colonial languages to give people the ability to speak in the language they are most comfortable in, and what impact do you think it had?
Yes, I think just to be very brief, we realized that when we're advancing equity, it should go beyond 2 languages. And one of the things we noticed is a lot of our young champions come from rural communities or communities where they speak Pidgin English, which is another form of English, not standard English. So, and then there are other communities that have local languages and they have local slangs that they also use to describe particular family planning terminology. So we wanted to ensure that the people we're trying to reach actually understand the message we're trying to pass across. So for us, that was something that was brought to our attention when we were doing our pitches. One of the judges made us realize that it's important to also incorporate the local languages, but also when we were recruiting nationally, we found that a lot of young people want to speak the language that is comfortable for them. And because their audiences respond better when they speak those local languages. So for us, the impact was really great. When we were recording the podcast, we saw the ease with which the young people were just talking freely, because I think sometimes we worry that young people don't want to talk about sexual and reproductive health, but it's because they are not using languages that are comfortable for them and their peers. So for us, we've really seen the impact of that. And even when we go on radio, people that are not educated, as well as anybody really can access the podcast in a language that is familiar to them, particularly for our radio audiences.
Great. Yeah, that's a really good point. And a lot of times, someone may be comfortable enough to understand a different language, but may not be as comfortable speaking in that language. So it sounds like you really were able to give a voice to a lot of these youth, which is really great. So thank you for your work on that. Okay, so up next, we will move to Population Foundation of India. So I'll ask Ramana Sabnam to go ahead and share information about their KM innovation. And just as an FYI, we are doing okay on time. We are scheduled to go until 9:30 a.m. Eastern time. So go ahead, and we'll just ask Ramana if you could speak a little more slowly so that our interpretation colleagues can keep up with the interpretation. Thank you so much.
Sure. Thank you so much. Good afternoon, everyone, and a very happy Pride Month. My name is Shramana, and I am representing Population Foundation of India. My work at the foundation is based in the intersections of reproductive health, gender, and digital intervention. Thank you, Knowledge Success and Data for Impact, for hosting this webinar. Today, I'll be presenting a family planning and reproductive health knowledge management innovation developed by combining components of technology and language accessibility. With over 602.2 million people speaking and understanding Hindi in India, it surpasses any other vernacular language in terms of reach and accessibility. However, despite its reach, the availability of reliable family planning and reproductive health information in Hindi has been limited, leading to a significant knowledge gap among Hindi-speaking communities. Population Foundation of India's Knowledge Management Innovation is a vernacular Hindi language family planning resource bank. This resource bank is specifically curated for the media, recognizing the role they play in shaping public discourse in day-to-day conversations. It presents a wide range of resources, including fact sheets, briefs, infographics, and audiovisuals, all categorized into a specific theme for ease of navigation and reference. In India, Hindi is not just a language, it is a powerful tool for communication for a vast majority of Indians. Next slide, please. Next slide, please. Thank you. With the support of Knowledge Success, we have developed a microsite that hosts this Hindi language family planning resource bank. By offering resources in Hindi, we are not only reaching a massive audience, but also ensuring that individuals can comprehend and absorb the information effectively in their own manner. This goes a long way in breaking down the language barrier that often hinders access to critical family planning information. What sets this resource bank apart is a comprehensive and interactive dashboard providing valuable insights into fertility, infant and child mortality, maternal and reproductive health, and the utilization of family planning services. Next slide, please. Furthermore, the Family Planning Resource Bank goes beyond our own resources. It provides useful link to external sources that offer additional insights into family planning and sexual and reproductive health issues. We understand that knowledge is best cultivated through collaborations, and by connecting readers to other trusted sources, we aim to force a holistic understanding of this vital subjects. Next slide, please. Thank you. By integrating language features, thematically categorizing articles, and adapting the microsite for multiple devices like mobile phone, laptop, desktop, tablets, and any kind of internet plan, the Family Planning Resource Bank is truly revolutionizing how family planning and reproductive health information is accessed in India. For example, if somebody is in a bad network situation and they want to access the family planning resource bank because they need some data, let's say a journalist, they can easily access the resource bank with any kind of internet data plan and any kind of device, which is maybe, let's say, a small smartphone to a big tablet. And that really helps in India, where the geography and demography is so diverse. We are breaking down the barriers of language and technological limitations, ensuring that apart from media professionals, individuals from all backgrounds and regions can access the information at their convenience. Next slide, please. Here you can see how the microsite has been categorized into various thematic areas in particular Hindi language, and that really helps the audience. Next slide, please. Thank you so much.
Thank you so much, Sharbana, for sharing that information about your knowledge bank. And so one question for you is, the primary audience of this knowledge bank is journalists who are reporting on sexual and reproductive health topics. What were you hearing from journalists that prompted you to translate the knowledge bank into Hindi? Or what roadblocks were they encountering that you knew this knowledge bank in Hindi would help solve?
Thank you so much for the question. Yeah. Journalists working in Hindi-speaking regions or catering to Hindi-speaking audience, they may face challenges due to language barriers. Now, translating the family planning resource bank into Hindi enables them to access and utilize the resources, which are informations based on graphics or audio visuals, and they can more effectively ensure that accurate data is used while reporting. And that helps in better communicating with the audience who are reading newspapers or who are consuming news from the digital mediums. So by offering family planning and reproductive health resources in Hindi, Population Foundation of India aims to enhance the accessibility of information, reaching a broader audience, including those who may not be proficient in English. Because mainly we see data in English, we also see academic research and non-academic research. They are majorly in Hindi, but however, I mentioned that Hindi is the most spoken language or the commonly used language in India. So it really helps journalists to connect with their audience and have public discourses in the critical topic of family reproductive health, considering local customs, practices, and beliefs. This localization can contribute to more nuanced and contextually relevant reporting. The translation of the Family Planning Resource Bank into Hindi demonstrates our organization's commitment to supporting journalists reporting on family planning and reproductive health topics. By providing a comprehensive resource in their preferred language, Population Foundation of India empowers journalists with the information and tools that they need to navigate complex subjects and communicate effectively with their audience. Most importantly, Population Foundation of India also has field staff in 4 major Hindi-speaking states in India, which are Uttar Pradesh, Bihar, Rajasthan, and Jharkhand. So it was also important for us to connect with the people in the language that they understand. Thank you so much.
That's really great points. I think we tend to think we're very good in global health programs about like translating materials for the general population of users. But I think sometimes we forget that even professional audiences who may be somewhat comfortable with English still may also need resources in their preferred languages as well. So thank you for that reminder, Sramana. Next up, we will hear from Laura Leeson, a Projet Jeune Leader in Madagascar. Over to you, Laura.
Thanks so much. And slide. So hello, everyone from Projet Jeune Leader in Madagascar. We are a Malagasy NGO that works to improve adolescent health and well-being through sexuality education. And our KM innovation was called Ampita Pitao. Ampita Pitao is a Malagasy expression that means pass it on. And the goal of our KM innovation was to pass on knowledge between local and national levels in Madagascar. To create this deep loop of knowledge, we used magazines, a tool that we've already been using in our own work in sexuality education. and seen to be effective. Next slide. So actually, when we wrote our application to the pitch, we were really frustrated. We had just seen another high-level conference with the same actors in the capital city, and that's what KAM looks like in our country. But because of this, policy and program decisions are often disconnected from local realities and knowledge, especially when it comes to issues about youth from rural areas. And so our KAM innovation was really meant to tackle this issue, that there are voices, sometimes the most important voices, being excluded from KAM systems, especially when it comes to using knowledge for decision-making. So we use magazines in our own work to create a feedback loop with our program's constituents. So with our students, with parents of students, and school staff in very rural communities. And there's not electricity in these communities where we work. And so paper-based magazines are contextually relevant and successful KAM tool that help us ensure we are listening and responding to our constituents' values and priorities. Next slide, please. So our use of magazines sparked this idea behind the Pita Pitao magazines. We specifically wanted to center the priorities and values of our constituents, so youth and people living in rural Madagascar, and create an even bigger feedback loop that would reach the top advisors and decision makers in youth reproductive health. We started out by picking 4 hot topics that have been on our minds for a while now. Topics that we see are really relevant at the local level, where there's some buzz at the national level, and where there are established high impact practices at the global level. And we developed a magazine on each of these topics for our constituents. The magazines are highly visual, super creative. They contain a mix of informational content and discussion questions. And they include a section in the back where we can insert pieces of paper so that community members can write back comments to us about the topic of the magazine. Those comments, so the knowledge and the opinions of youth and local communities, feed into iterations of magazines on those same topics, but that are destined for technical advisors and decision makers at the national level. Next slide. So this is just a sample spread from one of the local magazines on sexuality education. It's been translated to English, but we wrote all the content in the local language Malagasy first. In just 2 months, this magazine generated over 1,200 comments from our community readers. And what was really interesting, but not all that surprising, was that comments from readers aligned really closely with international best practice on sexuality education. And that's in spite of the government's initiatives, which weren't so best practice in nature. Next slide. In our decision maker magazines, we intentionally wanted to highlight global best practices with perspectives drawn from the local comments. So these decision maker magazines were also visual and creative because we've seen this format work before, and it's really attractive and novel to decision makers. And importantly, we wanted to present perspectives and calls to actions in really sensitive ways. We've seen over and over again that critical information is rejected by decision makers because it feels like someone's pointing the finger at them, or it seems overly negative, overly fatalistic. And so that's why we took a different approach. In the Decision Maker magazine about sexuality education, for example, we were able to sensitively breach the topic by first grounding the issue in what the government was already trying to do and using their own language. We drew from best practice reports and statistics, but we put the community's comments front and center. And we synthesized all this information into clear, positive, and most importantly, realistic policy recommendations. Next slide. So we disseminate the magazines to decision makers through one-on-one meetings, at conferences, at the high-level meetings that continue and will always exist. And we received a lot of positive responses. So like this quote from a senior Ministry of Education official shows, the idea of generating and sharing constituent knowledge for national level actors was actually a really radical idea for a lot of the people we talked to. But the way it was presented was super compelling and made sense to the context we work in. So much so that we have already seen actions taken by policymakers and government officials in response to the magazines. So Project Jeune Leader continues to use our P2P Town magazines in our organization as a CAM and advocacy tool. And we're really excited to see, what will come out of it next. Thank you so much. And I'll share a link in the chat about more information about our CAM tool. Thank you.
Thanks so much, Laura. This is so exciting. 1,200 comments, that's really amazing. And your magazine series, blended storytelling and community feedback to inform policymaking. And it sounds like it's already had an impact, which is, so exciting and so important. I wanted to hear from you, which component of your CAM innovation do you think was most important for ensuring that local voices were heard?
I think that just the fact that the content was so contextually specific and built off of these relationships we would already garnered, it was really relevant and really attractive to readers. So if you go on our website, you read the English versions, it might seem, some of the content might seem kind of weird or, unnecessary details, but those were details specific, especially Malagasy language, that we knew would catch people's attention and resonate with them. And for example, in our issue about violence in schools, we used a story that we had made based on a really popular song from the late 80s, early 90s. It's a very nostalgic song, and we kind of redid it to introduce the problem of violence in schools and provide some solutions, because we know that wouldn't be shut down. It would open the door, because literally what we've seen is people have very nice informational briefs, but when you present those to decision makers, they reject them because it's not in line with their worldviews. And so that kind of contextualized content from our team was really important in making these a success.
Yeah, that's really great. I mean, we hear over and over how important it is for context, and kind of goes back to also what we have highlighted in our logic model with the equity prompts and the checklists, in terms of like whose voices are included and who makes the decisions about what information to share and how to share that information. And so it sounds like you did a really wonderful job of making sure that the community's members themselves were leading the way, and that their voices were the ones who were highlighted. And even if, that may seem quote unquote weird to someone sitting, in the US or somewhere else, but if it's relevant for them and if it helps them to improve their health and their lives, then that's what's really important. So thank you so much, Laura, for your wonderful CAM innovation. So we do have a little bit more time left in our webinar. And so at this point, I'd like to turn it over to Natalie to help moderate the Q&A portion to hear from the audience members themselves.
Yes, thank you. Hello again. It was great to hear those 3 presentations about the 3 different KM innovations from the pitch. So we'll now open it up to Q&A. It's now your opportunity. There were a few questions that came in during those presentations, but we can now open it up for more questions. And there were a few questions about logistics, so just wanted to confirm that we will be sending a recording of both the English and the French, and we'll be sending the slides again to everyone after the webinar. So there is this first question sent to us. It's a question for Laura from Project Jeune Leader. She wanted to know more about the graphic and visual design. Those images were very striking and really, visually appealing. She wanted to know more about how the design of the magazines was planned, and just how did you go about designing that?
We had the benefit of having many years of experience doing magazines. We do magazines for students in our school, and then we also did our magazines for our own constituents for feedback. So we learned a lot, but it really aligns closely with our organizational values. One of our values is fun, and so we just like the positive spin on things. And practically speaking, we worked with our team and a local designer, and we really thought carefully through colors, through images, so that they're contextually relevant. And even things like, okay, is this color gonna, have any political sensitivities because it's associated with a certain party? Those were details that our team was able to think through because of our close work with communities. So I hope that helps.
Yes, thank you for answering, Laura. I think that was a great response. And I saw a couple of hands raised, but please just type your question please type your question in the Q&A, because since it's a webinar, the participants cannot unmute, and we'll be, moderating the questions that come into the Q&A. So I see there is a question from Sally from D4I. Sally, if you can unmute yourself, you can feel free to ask this question aloud. It's a question from Ramana from Population Foundation of India.
Yes, thank you. I wanted to ask if through this project, if they used the Demographic and Health Surveys API for Stat Compiler and all the other indicators for the translation. Just interested if you use that tool that was funded by USAID as well.
So Ramana, were you able to hear the question?
Hi, I think I missed the question. Is it possible to repeat that?
Yes, thank you for your presentation, and I was really excited to see that the translations of the indicators, and I'm wondering if you had used the Demographic and Health Survey Program's API, which is their indicator database for all DHS program surveys and including the National Family Health Survey in India.
Right. Thank you for the question. For the knowledge bank on family planning and reproductive health in Population Foundation of India, we have used the National Family Health Survey report data as our base, and basis that we have created all our indicators and all our infographics as well. So I would say that the major contributor to the indicators and major contributor to the data that you see on the microsite is India's National Family Health Survey report.
Great. Thank you, Sally and Sramana, for those questions. We have another question about the Learning Circles evaluation, and I'm going to direct this to Roweda to answer. The question is, was there any concern about or evidence of agreement bias in the Learning Circles surveys? Roweda, take it away.
Sure, yeah, thanks for that question, Tori. So yes, there is always a risk of agreement bias in surveys. So I can't say that that wasn't a factor potentially, but we did pair, we had a mixed methods evaluation. So in addition to the survey, we also conducted in-depth interviews with select members of the Learning Circles participants. And in those interviews, we were able to get more nuanced feedback about the Learning Circles program and what we actually use the most significant change questions for to kind of lead the way in those interviews. And so we were able to get a lot of great feedback about the Learning Circles program in those interviews related to like what kind of impact the program had on their knowledge and their networking with other members of the Learning Circles program. So we believe, using that mixed methodology really helped us to get a full picture of what kind of impact Learning Circles program had. And some of, you can read more in the article that we put in the link, and I'm happy to drop that link again to find out more details about that.
Yeah, I think, Rueda, you're going to get a spike in readers to this article now after this webinar. So thank you for that question and answer. We currently don't have any open questions in the Q&A. So I just want to make the invitation again for anyone who'd like to ask. We do have 15 more minutes, but if there's no questions, we could close the webinar early. Great. I do see a question that came in. Thank you. This is a question again for Population Foundation of India, Sramana. The question is, how did you determine the thematic areas for your site? And how well is the site being used? So a question about the usership and maybe the analytic use of your site. There's another part of the question, but I'll let you answer to this first.
Sure. Thank you so much for the question. I think I would like to present it by saying that it is a people-powered project, which means that our motto was that the knowledge bank reaches people in India in their preferred language, which is Hindi. And for categorizing the information thematically, we relied on the NFHS again. We saw which are the prior areas or which are the priority areas that we have to focus on. We also collaborated with external organizations for original articles, which we translated to Hindi. And that means that we were also in touch with colleagues who work in the similar area, and their opinion also contributed to how we thematically categorize the buckets, as we say in the microsite. So I think in a nutshell, we can say that it is mainly the people's need or people's requirement that prompted us to categorize the buckets. Another thing that could be noticed is the kind of reporting or journalism within the family planning, reproductive health, sexual and reproductive health genre that was happening in India and that is still happening in India. We picked out the major topics, and that's how we could put in the information in those thematic buckets. Thank you.
Great, thank you. And last part of that question, Sarmana, was what adaptations do you see that are needed for the future as you're continuing to improve and update the knowledge bank?
Right. Right now, the microsite hosts the Family Planning Resource Bank, which is the knowledge management tool that we are using for disseminating information on family planning and reproductive health, is based in Hindi. Hindi is the most popularly picked up language by journalists in India. But as we all know, that India is a very diverse country with its various cultural and language diversity. There are regional newspapers, there are regional journalists who prefers reporting in the language of their home state or their geographical area. Let's say in the northern and central part of India, Hindi is understood, widely spoken. People write in Hindi, and people also acknowledge information in Hindi. And when you go to the eastern part of India, in the state of West Bengal, in the state of Assam or Tripura, Bengali is a very widely spoken language. So maybe in the future, what we are planning is that we will integrate more languages in the language switcher, so that other journalists and other people in the public policy space who want to access information in family planning and reproductive health in their preferred language to reach the people that they want to, because of the ease of expression in one's own language is always an enabler to reach the masses. So the plan is maybe in the near future, we will integrate more languages in the language switcher, and we'll also disseminate the resource bank widely through social media and digital media intervention so that people get to know also about it. Thank you so much.
Great. Thank you so much. That's great to hear. I'm sure a lot of people will be happy to hear that your team plans on integrating more local languages spoken in India. So thank you. I see Sally, you have your hand up.
Yeah, I just wanted to ask a question about the equity toolkit and the tools that you've been using. And since this is a hot topic, I'm wondering if this tool has incorporated like AI, Chat GPT for translations or whatnot, and maybe, you know, maybe this isn't the point of this webinar, but I'm just wondering if that's been considered within any of these tools or will be in the future.
Sure, I can start to answer that, and if there's anything to add, Rueda, you can pick it up. So yeah, Chat GPT is like taking us away right now, and we've definitely had a lot of internal discussions at Knowledge Success about what this might mean for knowledge sharing. It's definitely a big topic right now, and I think unfortunately there's not a lot of evidence of what it will mean. But so I think the tools were not developed with Chat GPT in mind, since that is so new, but we definitely do, you know, when we consider digital platforms and digital knowledge exchange platforms, I think that encompasses a wide array of tools and what that can mean. So certainly digital AI is part of that. And, you know, to the other side, to the analysis of what are the inequities we see in knowledge exchange, there's certainly a lot to be said about the inequities in AI, right? And how the systems, you know, that's inherently designed with certain biases in the system, and that's then, you know, translated, you know, affected by the users of the system. Rueda, I don't know if there's anything else you want to add.
No, not really. Just to say that that's a great question. And yeah, I think we missed the Chat GPT things by like a few months because Chat GPT came out after we published the checklist. But I think that's something that we can definitely address in future iterations of the checklist and the Building Better Programs guide. So thank you for that.
Great. Seeing as I don't see any other questions, I may suggest that we end the webinar a little bit early. I think we can close. I can take a few words of closing. If you can go to the next slide, please. So yes, we just wanted to share our contact information. Like I said, Rueda and myself and the rest of the Knowledge Success team are very open and interested in hearing your feedback of the equity tools and the checklist. If you want to share that with us as you begin implementing with your teams. So here's our contact information, and we've also shared the contact information of the pitch panelists if you'd like to get in touch with them and hear more about their KM innovations. So thank you so much to all of you for joining and listening to our presentations and participating in the Q&A. As this topic of equity and KM for global health is truly an emerging discipline, and as Sally's question just acknowledged and alluded to, there are, you know, constantly new factors coming into play that have an impact on this work. So it's really important and special for us that we were able to create this space and that so many of you joined and engaged in the conversation. This is, you know, a big part of exchanging knowledge in this area. So Thank you so much. And we will provide the recording and slides, a written response to the Q&A within a few days. So thank you. Have a good rest of your day.
Thank you so much.